Hi guys, this is Dr. Bhasha Mukherjee. If you're new here, I am a GP trainee, former Miss England and media commentator. Majority of my page is mainly things that I've been doing recently, which has been media commentating on various medical topics, including politics. In the past, I've done reviews, I've done basically my experiences of doing things as a patient, not as a doctor, and going into the medical side of various different treatments, whether it's aesthetic treatments or whether it's been actual medical treatments. For example, laser eye surgery, veneers, PRP treatment, all these things that I've talked about on my channel already. So this is another such video where I talk about my experience as a patient rather than as a doctor, but we go into the medical side of that. And today's topic is Chalazion surgery. So let's start off with what is a Chalazion. So a Chalazion is a lump of the eyelid and it's quite common. It's not the same as a stye. A stye is usually a hair follicle that gets blocked up and that leads to an infection which then oozes or it kind of just goes away by itself, but it's more closer to the edge of the eyelid, whereas a Chalazion is more deeper and is actually a blocked gland, oil gland, because surprisingly your eyelid produces a lot of oil. Some of this fluid, some of this oily fluid, we call it meibomian fluid, essentially lubricates the eye as well. So this can get blocked up for various reasons. And that's what happened to me. I had a Chalazion. Now, there are lots of different conditions that can affect the eyelid. Mainly they are related to poor eyelid hygiene, especially if you're a makeup wearer. You can develop blocked pores or infections of the eyelid, mainly from wearing makeup products that might be out of date, carrying bacteria. But it can occur to people who have eye conditions as well, like dry eyes, wear eye contact lenses, or even if they've got a skin condition which makes their skin barrier more prone to breakage and essentially can cause eyelid disease. Now, to tell you the story of what exactly happened, in July 2024, I started feeling a little dull ache on my eyelid and I thought I'm getting a stye, but I wasn't really seeing a head. And a stye usually develops very quickly, whereas a Chalazion can take a little bit longer. And for me, that's exactly what happened. I had a dull, slow ache for about 2 days, which then slowly started becoming into a swelling of the eyelid, but there wasn't a point in one area. It was actually a full-blown eyelid that was essentially inflamed and infected. And I started off with having 3 days of topical antibiotic cream. It's called chloramphenicol cream. It's very easily obtainable even from your pharmacy. I used this cream for 3 days and it still was not getting any better. I was really struggling to blink, open my eyelid because my whole eyelid was so swollen. So then I went on 7 days of oral antibiotics, flucloxacillin, which is a very common antibiotic that's given. It's a penicillin-based antibiotic, and it is usually given for skin infections. And I had it for 7 whole days. And thankfully, the infection did get better. But the infection got better, but the actual collection, which was the lump essentially, that didn't go away. The collection now had got rid of all the bacteria, but it was still a blocked pore essentially. And generally speaking, the mainstay of treatment for something like this is just hot compress, because essentially you're allowing, you're promoting those, the hard lump that's formed for that to kind of liquefy and slowly for your body to get rid of it by itself. So I was doing that. I was doing hot compresses, and actually most people, if you have a Chalazion or an eye stye like this, it's quite common for your GP to recommend hot compresses if you first develop this condition. So that's what my GP told me to do, but my GP said that I need to do hot compresses 5 to 6 times a day for about 2 weeks at least. And I went back to my GP after 2 weeks. I actually went back after a whole month after I had developed the Chalazion to be referred to the ophthalmologist. But my GP suggested that I carry on doing hot compressing 5 to 6 times a day, or at least every 2 hours for a further 2 weeks, every single day. And that was clearly impractical. I'm a busy person myself, I work, so it wasn't going to happen, but I still tried my best. But I knew it wasn't going to go away because of the size of the kind of lump. It wasn't going to go away so easily. So it was then that I was referred to the ophthalmology team. After about a month, I got a notification of my appointment, which was going to be a whole 6 months later from the date of the referral. And I had no idea that actually within the NHS, they first see you, then they give you a sort of a new date for your operation, and that could be up to 6 months to a year from the point of when you first get seen. And the first day they'll see you can be up to 6 months after the first day that you've been referred. So you could be potentially having to wait a whole year and a half for your surgery, for a simple surgery that for me took less than 5 minutes to complete, which was very disappointing. And let me tell you, my NHS appointment has actually been indefinitely been cancelled and not received a new date for it, which is where this treatment came in for me. I was exploring private options, which actually are quite affordable even in the UK. They're about £500 roughly in the private market, and you can go to any that you prefer to. There are loads of options locally. I'm based in London, so I went with a practitioner at Harley Street called the Harley Street Eye Centre. They were very, very kind, and from the offset they gave me a full breakdown. It was very personalised care, and they really worked around my schedule. So what did the actual treatment entail? Actually, the treatment was very, very simple. It is over within 10 minutes from start to finish. I arrived, I was told that I shouldn't be wearing any makeup. I was treated by a very senior ophthalmologist. First, they gave me some eye drops. These eye drops contained a topical anesthetic that made my eye feel a bit funny. They told me it would be a bit stingy, but it actually really wasn't. I also had a full-on eye test to check the back of my eyes, the front of my eyes, to look for any dryness, that I had any lid disease, and they also checked my actual vision. Thank goodness, 4 years from when I had my laser eye surgery, I still have 20/20 vision, which is really good. So after that, once the topical anesthetic had started working, I was then taken into another room. I had a lovely lady who was holding my hand the whole time, because I am a terrible patient, literally, and I needed to hold hands. They told me to really calm down and really relax and think about happy thoughts, but it was a really weird sensation. So the next thing that happened is they essentially went in from the top of the eyelid to insert the anesthetic, the local anesthetic. And this is a tiny, tiny needle, very, very small needle. And obviously in the hands of a very expert surgeon, he literally went in from the top and inserted in several areas, essentially made the lump itself bigger by injecting it with more local anesthetic. And then he would prod it from the top to see if you can feel any pain. You should be able to feel pressure, but you shouldn't be able to feel pain. I started feeling like I couldn't feel my eye anymore after a couple of seconds, I would say. It works really quickly. And they always check with you to see that you're comfortable throughout the procedure. The next thing that happened is that he took a clamp and he was to invert my eyelid. The only thing was that my eyelid was already so big that it really was feeling uncomfortable, and I told him to stop, and he stopped. And he waited for the anesthetic to work for a bit longer, massaged it into place, and then tried again. And this time I could just feel like this dull ache, or even like a pressure sensation, just like if your eyelid was pushed backwards for ages. And I could just literally feel like this pressure, like someone's putting pressure on my eyelid, as he was essentially scraping out the insides of this lump. And literally straight after this, they pretty much placed a bandage on my eye, and within minutes after that they took the bandage off as well, and my eye was kind of droopy to one side, but it wasn't painful. It wasn't until about at least 4 or 5 hours later that the kind of drooping went away, and that's just the local anesthetic wearing off, because generally the local anesthetic can make your muscles essentially paralyzed as well, but that only lasts for a short period of time. My eyelid was still swollen, and I was given antibiotic cream to essentially apply every, I would say, like three times a day at least. And I was also given this special eye wipe. It was called Clear, I think it was called, to essentially clean the top of my eyelids for the next couple of days. So the aftercare, I was told that I should not get any tap water into my eyelid for at least 24 to 48 hours. So although it says in the aftercare booklet that you can shower on the same day, I think I wasn't sure entirely if I could wash my hair, because I knew that if I washed my hair I would get water in my eyelid and eyes. So I delayed washing my hair or getting any physical water into my eye for at least 48 hours post the procedure. I continued to clean my eyes purely with the Clear. I was given a whole pack of those to use, and in between all these I was also using my antibiotic eye cream. And this antibiotic eye cream, it says in the aftercare book to use it for at least 2 weeks, but actually I used it only for 10 days. and that was fine because my eye had healed. And actually the main inflammation was probably for the first 4 days, and the first 4 days the only kind of main sign of it was that there was some lid swelling, and that was slowly going down with time. And there was a lot of, I would say, discharge, not a lot of discharge, but you know, like when you get conjunctivitis you get a lot of eye boogers, that kind of thing was happening. I was getting frequent sort of eye bogies, if that makes sense, on the left eye itself, which was the affected eye. And that's just a sign of your body healing and your eye healing. There was probably a tiny bit of like gritting sensation, which probably lasted 24 to 48 hours max, and then that was getting better pretty quickly as well. So in terms of using the antibiotics, I was told to use it on the actual eyelid for during the day, and at night I was told to put it on the inside of my eye as well. And that's because actually the skin has much better reabsorption of the product than the actual eye conjunctiva, which is the white of your eye. The blood supply is much better to the actual eyelid skin, so actually the absorption through the skin is much better, so it's better to just apply from the top of the eyelid. And actually I know that I was using this cream because I would kind of get like this phlegm at the back of my throat, and that would taste a bit bitter, and that's when you know that that thing has kind of made its way and been drained by your sort of you have glands that essentially drain the fluid from your eyes and things like that, and it usually just goes, it's all connected to your sinuses, so I knew that it was going through my system essentially. So yeah, I used my antibiotic eye cream for a total of 10 days. I used the Bleffer Clear pretty much mainly at night after I had kind of switched over to washing my eyes with kind of water after 48 hours. It was also told that I shouldn't do any exercise for a few hours, but actually contact sports is advisable to kind of skip for a few weeks at least, which I'm going to plan to go into because I do martial arts, as you know, probably at the 3-week point. It's a good thing that it was over the Christmas break and New Year's break, so I got a break from doing any contact sports in that way. But technically I think contact sports more things that there's likely to be contact with other people, like rugby, or you know, you can get a ball in your eye or something like that. I think with martial arts, majority of it is actually cardio, and you can avoid facial contact. Majority of the time with my martial arts, we don't actually we try to avoid contact to the face anyway, so I think I should be fine when I do go back. The other things that I mentioned in the aftercare, which I will sort of tell you guys, is how long the swelling usually stays. So I was told that because the size of my lump was quite big, there can be a fibrous capsule which kind of remains, and actually it's very difficult to tell, especially when I've got makeup on. You really can't tell. Even if I don't have makeup on, if I'm really very looking very carefully, I can see and kind of almost like an outline of where the lump used to be. I suspect with time your body will reabsorb and it usually goes away, but I was offered essentially after a month of the treatment to have a steroid injection if I wanted to have it. I'm going to have a follow-up with my doctor to sort of review if I still need it, essentially. But I think one of the main important things for me, I was told should not be wearing any eye makeup for at least 2 weeks, which for a girl, and especially for someone working in media, I think that's quite a big deal. Most of the other things that was in the aftercare in terms of swimming, wearing contact lenses, don't really apply to me as such because I don't really do them very often myself. Now I am completely free of the lump. My eyes are symmetrical again, and it really has been life-changing. Please look out for the video where you actually get to see the procedure itself, start to finish, and like a vlog essentially. So I will link that vlog right up here so you can have a look at that also. Thank you so much for watching this, guys. If you found this educational, please drop me a comment with any questions that you have about lid disease as well, and I will drop a link of the clinic that I had my eye surgery done. I want to say a big thank you to Harley Street Eye Centre for looking after me and really coming and rescuing me when I didn't feel there was any hope in terms of being a patient on the waiting list for the NHS. And this is where I can really feel for the patients that are on waiting lists, waiting for procedures of various kinds. I mean, not everybody can afford private healthcare, I understand that. But I will say that I've had a really good experience myself. So don't forget to like, share this video, drop me a comment, and also subscribe and click that bell icon. Thank you so much. Mwah.